Hi everyone! As pet parents, there's nothing more important to us than keeping our furry family members healthy. And that's why we're here today to talk about a hidden danger that every cat owner needs to know about. It's heartworm disease. You see, heartworm disease in cats is a sneaky and serious condition that often flies under the radar. Unlike dogs, who are natural hosts for heartworms, cats are considered atypical hosts. This means the worms don't always mature into adults in cats, but don't let that fool you. Even immature heartworms can wreak havoc on a cat's heart and lungs. The real tragedy is that many cat owners don't realize their feline friend is infected until it's too late. Symptoms can be vague, easily mistaken for other issues, or even completely absent until the disease has progressed significantly. That's why understanding the risks, recognizing the subtle signs, and most importantly, focusing on year-round prevention is absolutely crucial. We need to get ahead of this silent killer and make sure our feline companions live long, healthy lives. Let's talk about how this sneaky parasite actually spreads. Heartworm disease is transmitted exclusively through mosquito bites, making it a threat almost anywhere mosquitoes are found. Here's how it happens. A mosquito bites an infected animal, usually a dog, and ingests microscopic heartworm larvae called microfilariae. These larvae mature inside the mosquito over a couple of weeks, transforming into the infective stage. When that infected mosquito bites another animal, it injects those larvae directly into the bloodstream. In dogs, these larvae typically grow into adult worms that live in the heart and reproduce. But in cats, things are a bit different. The larvae often die before reaching maturity, which might make you think cats are off the hook. But even those immature worms can spell trouble. They can travel to the lungs, causing significant damage and inflammation. This leads to a condition known as HARD, or heartworm-associated respiratory disease, which can severely impact your cat's breathing and overall health. Now you might be thinking, my cat lives indoors, they're safe, right? Not so fast. Mosquitoes are masters at sneaking into our homes through open doors, unscreened windows, or even tiny gaps. It only takes one bite from an infected mosquito to put your cat at risk. That's why, regardless of their indoor or outdoor status, every cat needs year-round heartworm prevention. Remember, we're talking about a potentially life-threatening condition here. Don't take any chances when it comes to your furry friend's well-being. One of the most challenging aspects of heartworm disease in cats is the silent nature of the infection. Unlike some diseases with clear-cut symptoms, heartworm in cats can be incredibly sneaky. Many infected cats show no symptoms at all in the early stages, or the signs are so subtle they're easily mistaken for other common feline ailments. We might notice mild coughing, a bit of difficulty breathing, or the occasional episode of vomiting. Our cats might seem a bit more lethargic than usual, less interested in playing or sleep more than they're used to. These subtle changes can be easy to miss or dismiss as just a cat being a cat, but as the disease progresses, the signs can become more severe. Loss of appetite, weight loss, and increasingly labored breathing are all red flags. Some cats might start breathing with their mouths open or take rapid, shallow breaths. And tragically, in some cases, the very first noticeable symptom is sudden collapse or even death. This can happen when an adult heartworm dies and releases toxins, triggering a massive and often fatal immune response. This unpredictable nature is what makes early detection so difficult. As responsible cat owners, we need to be extra vigilant. Pay close attention to any changes in your cat's behavior, appetite, or breathing, no matter how small. If you notice anything out of the ordinary, don't wait. Contact your veterinarian immediately. Early intervention, even if it turns out to be something else, is always the best course of action. Remember, we are our cat's advocates. It's our job to be aware of the risks and take action to protect them. Diagnosing heartworm disease in cats can feel like trying to solve a tricky puzzle. It's not always straightforward, and that's because cats are not the ideal host for heartworms like dogs are. Unlike dogs, where a simple blood test can often confirm the presence of adult female heartworms, cats typically have lower worm burdens. they might have just 1 or 2 worms, and these worms might be immature or even dead, making them harder to detect. This means that standard heartworm tests, while useful, can sometimes produce false negatives in cats. To increase the chances of an accurate diagnosis, veterinarians often rely on a combination of tests. Antibody tests are used to detect the presence of antibodies, which are proteins produced by the cat's immune system in response to heartworm exposure. Antigen tests, on the other hand, look for specific proteins that are released by adult female heartworms. Chest X-rays can be helpful in assessing the lungs for any signs of inflammation or damage caused by heartworms. Echocardiograms, which use sound waves to create images of the heart, allow veterinarians to visualize the heart and look for any signs of worms or abnormalities in heart function. But even with all these tools at our disposal, diagnosing heartworm disease in cats can still be a challenge. That's why veterinarians often have to consider the cat's clinical signs, medical history, lifestyle, and risk factors when making a diagnosis. This complexity highlights why prevention is so vital. It's always better to prevent this potentially devastating disease than to try to diagnose and manage it after the fact. Remember, knowledge is power. The more we understand about the challenges of diagnosing heartworm disease in cats, the better equipped we are to protect our feline companions. This is the part I hate to talk about, but it's crucial for every cat owner to understand. Here's the hard truth. There is no safe and effective cure for heartworm disease in cats. The medications that are used to successfully kill adult heartworms in dogs, like melaslamine, are simply too toxic for cats. So instead of aiming for a cure, treatment for heartworm disease in cats focuses on managing the symptoms and supporting the cat's body as it deals with the inflammation and damage caused by the worms. Veterinarians might prescribe corticosteroids, such as prednisone, to reduce inflammation in the lungs and airways. Bronchodilators can be used to help open up the airways and ease breathing difficulties. If a cat is experiencing severe respiratory distress, oxygen therapy and hospitalization might be necessary to stabilize their breathing and provide supportive care. Antibiotics may be prescribed to treat any secondary bacterial infections that can develop as a result of the weakened immune system. In very rare and extreme cases, surgical removal of heartworms using a specialized catheter might be attempted. However, this procedure is incredibly risky, requires a highly skilled veterinary team, and is not always successful. The lack of a cure for heartworm disease in cats underscores the absolute importance of prevention. It's not just a recommendation, it's the single most effective way to protect your cat from this potentially devastating disease. Monthly heartworm preventatives are readily available, easy to administer, and far, far safer than the alternative of trying to manage this complex and often heartbreaking disease. Now that we've covered the difficult stuff, let's focus on the good news. Heartworm disease in cats is highly preventable. And trust us, preventing this disease is far easier and less expensive than dealing with the heartache and uncertainty of a diagnosis. The best part, heartworm prevention for cats is incredibly convenient. It comes in easy-to-use options like monthly topical treatments, which are liquids applied to the skin, or oral medications, which are available as chewable tablets or pills. Many of these products offer broad-spectrum protection, meaning they also guard against other pesky parasites like fleas, ticks, and intestinal worms. It's like a one-stop shop for your cat's parasite protection needs. Now, here's a common misconception I hear all the time. My cat lives indoors. They don't need heartworm prevention. But remember those sneaky mosquitoes we talked about? They can easily slip into our homes, especially during the warmer months. Plus, mosquitoes are incredibly adaptable. They can survive and even thrive indoors, especially in heated homes. This means that even indoor cats are at risk, especially if you live in an area with a high mosquito population. The bottom line is this: year-round heartworm prevention is essential for all cats, regardless of their lifestyle. Don't wait until it's too late. Talk to your veterinarian about starting your cat on a preventative as early as 8 weeks of age. And remember, every little bit of prevention helps. Do your part to control mosquito populations around your home by eliminating standing water, keeping window screens in good repair, and using pet-safe mosquito repellents when necessary. Remember, just one bite from an infected mosquito is all it takes. And when it comes to heartworm disease in cats, prevention is truly the best and only defense. Let's clear the air about some common misconceptions surrounding heartworm disease in cats. These myths can be misleading and even lead to risky decisions that could jeopardize your cat's health. Myth number 1: only dogs get heartworms. This is absolutely false. While dogs are more susceptible to heartworm infection and tend to have higher worm burdens, cats are definitely not immune. And because cats are generally smaller and more sensitive to the inflammation caused by heartworms, even a single worm can have serious consequences for their health. Myth number 2: indoor cats don't need heartworm prevention. We've already debunked this one, but it's worth repeating. Mosquitoes are masters at infiltrating our homes, and even indoor cats are at risk of being bitten. Don't let your guard down just because your cat prefers the comforts of home. Myth number 3: heartworm disease is curable in cats. Sadly, this is not true. As we discussed earlier, the medications used to treat heartworm infection in dogs are far too toxic for cats. While we can manage the symptoms and provide supportive care, there is no guaranteed cure. These myths highlight the importance of staying informed and relying on accurate information from credible sources like your veterinarian. Don't fall prey to misinformation that could put your cat at risk. When in doubt, always consult with your veterinarian to get the most up-to-date and reliable information about heartworm disease and prevention. Remember, knowledge is power, and when it comes to our cat's health, we can never be too careful. No matter how healthy your cat may seem, regular veterinary checkups are absolutely essential, especially when it comes to staying ahead of silent threats like heartworm disease. These visits are about so much more than just updating vaccinations and checking teeth. During these checkups, your veterinarian will take a comprehensive look at your cat's overall health. They'll assess your cat's risk for heartworm disease based on their lifestyle, where you live, and their medical history. They'll recommend the safest and most effective heartworm prevention options tailored to your cat's individual needs. And if there are any concerns or risk factors, they can perform screening tests to rule out heartworm infection or catch it in its earliest stages. But it's not just about heartworm disease. Regular veterinary checkups are crucial for detecting a wide range of potential health problems before they become serious. Cats are masters at hiding pain and illness, so by the time we notice something's wrong, the problem might have already progressed significantly. These checkups are also a valuable opportunity to ask your veterinarian any questions you might have about your cat's health, discuss any concerns, and stay up to date on the latest recommendations for parasite prevention and overall wellness. Think of your veterinarian as your partner in protecting your cat's health. So there you have it, folks. Heartworm disease in cats is a serious and often silent threat. It doesn't always show obvious signs early on, and once it becomes severe, our treatment options are limited. But here's the good news. Heartworm disease is highly preventable. With just one monthly dose of a veterinarian-recommended medication, you can shield your cat from this potentially devastating disease. It's crucial to understand how heartworms are transmitted. Remember, all it takes is one bite from an infected mosquito. Be aware of the subtle symptoms and prioritize those regular veterinary checkups. Prevention is simple, affordable, and something you have complete control over. Whether your cat is an indoor couch potato or a fearless backyard explorer, they rely on you to keep them safe. Don't wait for signs of illness. Act now. Stay consistent with prevention, and always keep heartworm disease on your radar. Your furry friend deserves a life free from this invisible threat.